Welcome to this overview of scope, standards, and legal considerations in advanced nursing practice. This presentation highlights the key regulatory and professional frameworks that guide safe, effective APRN practice. Scope of practice defines what an APRN is educated, competent, and legally authorized to do in clinical practice. It is shaped first by formal education, national certification, and ongoing specialized training. Scope is also defined by role and population focus, meaning APRNS must practice within the patient populations and specialties for which they are prepared. State nurse practice. Acts and boards of nursing provide the legal framework that authorizes or limits practice activities. In addition, facility policies may further restrict practice, even when state law permits an activity. Boards of nursing play a critical role in interpreting gray areas of practice and clarifying what is permissible when legislation is not explicit. APRNS must continuously evaluate whether their clinical activities fall within their legal and professional scope of practice. The first step is verifying that you have the appropriate education or documented continuing training for the activity. Next, you must confirm that the activity is authorized by your state's Nurse Practice Act and Board of Nursing rules. Competence assessment is equally important. Discomfort or uncertainty often signals the need for consultation or referral. Facility policies must also be reviewed, as organizations may impose stricter limits than state regulations. When questions arise, the safest approach is to pause, seek clarification, and prioritize patient safety over role expansion. Prescriptive authority is one of the most highly regulated and variable aspects of APRN practice. States operate under full, reduced, or restricted practice authority models, each with different requirements for collaboration or supervision. In restricted practice states, APRNs must maintain formal collaborative agreements with physicians to prescribe medications. Oversight of prescribing involves multiple entities, including the State Board of Nursing, boards of pharmacy or medicine, and the Drug Enforcement Agency for Controlled Substances. APRNs must also comply with prescription monitoring programs and controlled substance regulations. Safe prescribing requires balancing patient needs with ethical judgment, evidence-based practice, and regulatory compliance. Legal authorization and reimbursement are closely connected in APRN practice. State licensure establishes the legal authority to practice, while national certification validates advanced clinical competence. Obtaining a national provider identifier is essential for billing and claims processing. Medicare credentialing is often a lengthy and detailed process, but it is required for direct reimbursement of services. To be reimbursable, services must be medically necessary, fall within APRN scope of practice, and meet state and payer requirements. Understanding these processes protects both professional practice and the financial sustainability of APRN services. Standards of practice provide a consistent framework for delivering safe, ethical, and high-quality advanced nursing care. These standards guide the APRN through assessment, diagnosis, planning and implementation, and evaluation. They ensure clinical decisions are systematic, evidence-based, and patient-centered. Core emphases include patient and family education, shared decision-making, and health promotion. Ongoing competence is essential and requires continuous professional development. Adherence to standards supports accountability, improves outcomes, and reinforces the APRN's role as a trusted healthcare provider. APRNs serve as leaders within interprofessional healthcare teams, coordinating comprehensive and patient-centered care. Accurate and timely documentation is a professional responsibility that supports clinical decision-making and continuity of care. Patient advocacy remains central, ensuring patient rights, preferences, and needs are respected. Professional excellence requires ongoing engagement in evidence-based practice and quality improvement initiatives. A PRNS must maintain certification and remain informed of evolving regulations. These responsibilities collectively support high-quality care and advance the nursing profession. This presentation highlights the critical legal, regulatory, and professional standards that guide advanced nursing practice. A PRNS should always consult their state board of nursing and organizational policies for practice-specific guidance.